Hi, and welcome to another episode of Before and Beyond from Dental Designs Clinic Singapore. My name is Maria, and I'm going to talk a little bit about what you can use Invisalign for in a patient's treatment. Invisalign can be used for simple cases, including just normal crowding or relapse after braces. It can also be used to plan for more complex cases before a restorative treatment. So if you're thinking about getting veneers or crowns and the teeth are not lined up, you won't usually get the best aesthetic result. I'm going to show you a few cases where Invisalign can be simple and a few where it can be used to set up for more complex treatment. So something like this, where you can see in the front of the patient's teeth, there's a little bit of crowding just here. So Invisalign can be used to correct that, and this is quite a simple thing to do and usually can be done in under 6 months. And the patient after this would need no further treatment. Their teeth would be aligned and they would probably have an easier time cleaning their teeth because there wouldn't be as much crowding. This is a relapse after traditional braces, so if you don't wear your retainer after you get orthodontic treatment, this is something that can happen. Very easy to correct with Invisalign. Moving on, this is another case where there's a bit more crowding on the top and the bottom, and this case is going to take a little bit longer, but because of some of the issues with the bite. However, it's very straightforward, and you can see this is a case that's in progress, and already there's quite a lot of movement. This is a little bit more of a complex case. However, also Invisalign can also be used to treat this. This is actually also a relapse after traditional braces where the patient didn't wear their retainer. And unfortunately, what has happened in this situation, as you can see here, is that the bottom teeth have shifted forward on top of the front top teeth. So that's called a crossbite, and that's something that Invisalign can correct. And you can see in the bottom photo that already there's been quite a lot of progress. So this case is in progress, but very easy to treat as well with Invisalign. This is a more complex case where the patient also had braces as a teen, didn't wear his retainers, and unfortunately had what's called an open bite. So he actually couldn't eat even a sandwich because his teeth wouldn't bite together. And Invisalign can be used to close this as well. So these cases that I've just shown basically just require Invisalign, and after that, the patient is pretty much done with their treatment unless they want to do something cosmetic. So in the previous case, you can see some of the white spots on the teeth that can be treated very conservatively with something called Icon or fillings, and to get a really nice aesthetic result, but it's a very minimally invasive treatment. And that's the nice thing about Invisalign. You don't need to drill the teeth down to do any of the cosmetic work. Moving on, this is a very complex case where unfortunately the patient had a previous implant in the front that failed and unfortunately lost a lot of bone in the front, but also the front teeth here collapsed. And what happened was she was basically almost biting into the roof of her mouth with her lower teeth. So if we want to make a final restoration, we really can't do that without moving the teeth back into a normal position. So for this case, we have no choice but to orthodontically, either with Invisalign or braces, move the teeth up in order to create room for the final restoration. So that is a situation where you can use Invisalign to set up for a future more complex treatment to ensure that you get a good result both functionally and cosmetically. The last case that I'm going to show you is a case that demonstrates how Invisalign can be used to set up for an aesthetic treatment. So in this case, you can see that the patient has a big gap between her two front teeth, and she was interested in getting veneers to correct some of the aesthetic concerns. So in this case, if you just go ahead and do veneers on the two front teeth, you're going to end up with two giant blocks that look like chiclets in the front, which nobody wants. So one of the things that can be done with Invisalign is the space can be redistributed. If you move these teeth a little bit further together and create a little bit of space between the teeth on the sides as well, you can get a really nice and even profile of the teeth and smile without reducing the teeth excessively. So it can also help to be more conservative when you're preparing the teeth for the final restorations. You don't have to drill away as much of the tooth structure in order to get a nice aesthetic result. So these are just a few examples of how Invisalign can be used in our daily practice and how it can help treat very simple cases and more complex cases as well. Thanks for watching.